Good to see you all. We are going to have this session on professionalizing health supply chain. And before we dive into the panel discussion, I'll just give a background of what this topic is about. My name is Johnson Anyona. I work as a supply chain advisor for InSupply Health. So who is InSupply Health? InSupply Health is an East African health advisory firm headquartered in Nairobi, and we are pioneering sustainable, scalable supply chain solutions on the area of data visibility, workforce development, and performance improvement. That's our mission and vision statement. And in terms of our approach, we are keen on contextualizing global solutions that have been proven and also innovative ones. We believe in putting the users at the center. That is the empathy aspect of it, empathy at the core, designing with the user in mind, and then offering high quality, contextualized, and technology-enabled supply chain solutions. So we have a project called Workforce Development that is running from 2022 to 2027, funded by the Bill and Melinda Gates Foundation. And the whole point of this project is to improve the effectiveness, sustainability, and resilience of public health supply chains. And we are doing it in a number of ways, which are our objectives. So we have 5 objectives in total, but I'll just mention 2 which are closely aligned with the topic for the panel we have this afternoon. Objective 1, that is focused on empowering and building capacity of the supply chain workforce. And Objective 3, that is working towards professionalizing the health supply chain. So some of the initiatives we've done, as you can see over there, aimed at empowering the workforce. We've just recently entered a partnership with AGLS and are now offering a short course on health supply chain management targeted for the health workforce at service delivery points. And this is, of course, CPD accredited. It is to start in July and is to run once per week for 3 hours over a 10-week period. And we have put there a QR code, which you are able to scan and get more details on registration and additional information. So, back to the topic of today, health supply chain professionalization. So what does it mean to professionalize a cadre or an area of specialty? So supply chain professionalization simply means transforming health supply chain management into a recognized profession that is of the highest integrity. And this involves standardizing and institutionalizing the different supply chain roles, competencies, and even the different trainings that we have and certification requirements that different service providers have to go through to upskill the health supply chain capacity. Why is this important? So what is the whole point? Why do we need to professionalize this? So currently, our workforce has a number of gaps, and we would like to create a pool of trained providers who are competent and are able to perform the supply chain duties. If you remember in your undergrad, the amount of training you were taken through on supply chain, I'm sure you can remember that it was very, very little. But yet, in fact, all of us or most of us, by nature of our work as pharmacists, are on a day-to-day performing different supply chain tasks. Whether you are at the manufacturing, warehousing, distribution, handling inventory, doing the LMIS reports, receiving, ordering commodities, and so on, and even at the service point where we interact with clients. Then we would like to have less reliance on external funding from donors as we build the pool of supply chain experts, and of course create more job opportunities on this area of specialty. I know in the morning there were talks about specialization, and I was happy that Professor Kalebo cited health supply chain as one of the critical areas. Then we would also like to have a defined standard of competencies for tasks. And I know the Pharmacy Board has been having some initiatives to develop, especially for pharmacists who are performing supply chain tasks. What is the job description for someone performing supply chain responsibility? And ultimately, we want to have a satisfied workforce where we have fewer turnovers. So that is just to give a background on the topic. And at this point, I would like to invite the moderator for this session, my colleague, Dr. Brian Mincha. Please give him a round of applause as he comes to stage. So Dr. Mincha is my colleague and is a capacity building associate with InSupply Health. He's dedicated at enhancing healthcare through efficient supply chain and through roles such as capacity building of providers. He uses his expertise to develop solutions that align with global standards of pharmacies. Karibu Brian, take it away.
Okay, thank you. I'll do the honors of introducing our panelists today. You can visit the Oxford abstract to see the extensive bio, which I think I'll just give a short overview. So the first to come to the stage will be Dr. Eunice. Welcome, Dr. Eunice. So Dr. Eunice is currently the Deputy Director of Pharmaceutical Services at the Directorate of Health Products and Technology. We recognize the mandate of DHPT to offer technical assistance and also capacity build counties in health products supply chain. And she boasts multiple years of experience in various capacities within public health sector. Let us give her a round of applause. Then next to the stage will be John Karani. Welcome, John. John is a procurement and supply chain leader. He was recently awarded the highest head of state commendation, the MBS, that's the Moran of the Burning Spear, in recognition to the work he's led as the chairman of KISIM, that's Kenya Institute of Supply Chain Management, transforming it into a recognized and respectable professional body. Give John a round of applause. Next is Dr. Gloria from MEDS. She is the head of supply chain and logistics at MEDS with multiple years of experience in the public sector, private sector, and senior management roles. She has achieved milestones such as revolutionizing the supply chain at MEDS, resulting to cost-effective last-mile delivery, reduced staff-related costs, and exceptional inventory management. Welcome, Dr. Gloria. Give her a round of applause. The next is Dr. Michael Mungoma, who is the Dean of School of Pharmacy at Mount Kenya University. He also has an interest and expertise in healthcare training, curriculum development, family planning, service provision, and also serve as the chair of the education committee at PSK. He looks forward to enhancing the scope of pharmacy beyond traditional dispensing. Give him a round of applause. Then next we have Dr. Naomi Muridhi. Naomi has multiple years of experience navigating the world of medical supply chain, managing both the public, private, and emergency health supply chain. She specializes in optimizing health supply chain operations from a logistic perspective for greater efficiency and effectiveness. Give her a round of applause. Welcome, Dr. Naomi. Then next we have Dr. Humphrey Mwavali. Humphrey Mwavali is the manager at the Practice Directorate at Pharmacy and Poisons Board. We recognize the role played by Pharmacy and Poisons Board in regulating the pharmacy practice in terms of licensure of practitioners to practice, continuous education, and also the development of guidelines and policies that guide pharmacy practice. Give him a round of applause. Okay. As we start, I'd like us to kick us off the discussion about the current state of healthcare, supply chain management. There are many approaches that have been contextualized to achieve this in various countries. Some choose either to go with a dedicated cadre, some choose to upskill an existing workforce. Which approach do you think would work for Kenya, and why would that work? We'll start with Dr. Eunice.
Okay, thank you and good afternoon. So from the policy perspective, of course, we are pharmacists in this forum, and one of our core skills that we need to have is the issue of supply chain management, because medicines are in our custody as pharmacists, and we'd want to enhance the skills of pharmacists to be able to provide that extra knowledge and expertise in supply chain. It's not the same as training a procurement person in health, but for us who already have training in health, then it becomes easy. Because remember, as we are procuring things, you're not just procuring like a book. You need to think of like what is essential, for example. Do you need to buy it? What quantities do you need to buy? Is it something that is critical for your population? Is it aligned to the disease patterns of the country? So there's a lot of extra knowledge you need to know, even as you acquire a health product. So for me, I would say we sharpen the skills of pharmacists, and that is not very well done in the undergraduate curriculum, but that is something that we can work on. Thank you.
Yeah, thank you so much. Glad to be here. I think from where I sit, it would be a very good thing to do what I want to call a situational analysis. Where are we right now, especially for the in-service people, just to back what Dr. Eunice is saying. How do you, creating a new cadre should only be limited in my mind to a very, very specialized level, but the pharmacists here just need to be infused with supply chain knowledge and make them better delivery, to better deliver their current role. So when you do what in supply chain are doing currently, situation analysis, where are we currently? Then from there, build up on what we need to fill the gap to make sure that the current people can deliver on their role.
Good afternoon. Looking at it from the point of having access to medicines, because here is a pharmacist forum, having access to medicines that are quality, safe, and efficacious. I believe the pharmacist is in a better place to manage the supply chain. As my colleagues have alluded to, I think the issues might be within the training aspects and also creating an avenue for specialization in that area, which I believe there are so many courses that actually equip the pharmacists with the skills to manage supply chain. So I believe in terms of, and I use the term here, pharmaceutical supply chain, then it becomes the pharmacist who is better equipped to manage that. Thank you.
Okay, thank you, Brian. I believe my team have preempted my thought process. And here I was looking at a three-pronged approach, more so to do with like hybridization. So when you look at the curriculum of BFARM training, first of all, as you've noticed also in supply has been able to point out, the training is not as comprehensive, so you actually have to do a lot of on-the-job training for you to be able to be at optimum. So one of the things that I would think about is that how comprehensive is the training of a pharmacist, especially in the last year before you graduate. And one of the things that you have been able to appreciate as meds is when we are able to receive students from BFARM, from private institutions, mostly from USIU. I think I saw Dr. Ermia somewhere here, and also Kabarak University. But we are yet to have students from public institutions. So can we standardize that or harmonize that aspect in terms of curriculum of training of a pharmacist? We'll also look at a short-term approach where my colleagues are talking about issues to do with the situational analysis of the current pharmacist. And all pharmacists, I want to believe in one way or another, whether in manufacturing, community pharmacy, whether you're in hospital, you're actually handling aspects of to do with supply chain. So aspects to do with upskilling, and I'm very happy to see that InSupply is doing a short course, a 10 weeks program to capacity build the pharmacists in order to have best practices during time of practice. That is actually a game changer, and I mean, not everyone wants to specialize in supply chain, of which you appreciate that, but you are welcome to the field. It's actually quite an interesting field. Another third approach is more looking at long term. We actually need to have supply chain pharmacists. It's a whole monster in itself. One of the things that I can say about pharmacists, we have a very short learning curve. So once you get in, you enjoy the process, you learn as much as you can. I mean, you can, let's join this. It's quite something. And when you're passionate about it, you don't feel like it's work. That would be my quick thinking on that. And also, once you do something like that, you have specialized units. We can actually handle the aspects of supply chain. I mean, you can actually do what you call task shifting. Like maybe I can give an example. If you're working in a hospital pharmacist, you have so many pharmacists, but they're not really, there are so many tasks that they perform, but because it's too many of them, they may not be as efficient or give quality output. So for me, it's just saying, let's specialize, especially having a specialist in terms of supply chain as a pharmacist, because you get quality output, and I talk about this from experience, being head of supply chain at Meds. Thank you.
Thank you so much. From an education point of view, I think for me is to really look at what is happening currently. Competency-based education is something that everyone needs to embrace as an institution of learning. With that, what I mean is that as we keep on evolving in this education space, so should the content and the delivery of this content. We've had several speakers previously talk about skills development, and this is something that should be ingrained in the education itself. BFAM is a very comprehensive program, and the component of supply chain management is also a very, very huge component. It is about doing a needs assessment and looking at how this curricula is being delivered, and ensuring that, one, something that was mentioned yesterday, teacher practitioners are introduced into the faculty so that we don't have people in the universities training supply chain management just based on publications. But we have people who are already in practice that can come to the universities and bring that relationship between what they are reading and what is outside there in industry, because that is also evolving. I mean, supply chain management that was there 10, 15 years ago, 20 years ago, is not what is happening now. Technology has come in, the use of software has come in, we have standards, we have new regulators, we have new players in the field. So that also has to come into the education, because when you look at the basic components of supply chain management, selection, quantification and forecasting, procurement, storage, distribution, these basics have not changed. But how this is being done and the tools of measuring efficiency of a supply chain is something that is improving every day. So beyond doing a needs assessment and really looking at the gaps in terms of training and imparting knowledge and skills, is also developing a structured training program, clearly addressing the pre-service and the in-service, which are things that are going to be clearly distinguished. Because with the pre-service, we are looking at people who are also overloaded with other expectations. But the in-service, there is also an appetite for getting people who are industry ready. So how do we bridge that gap? I think that is what we really need to focus on. Thank you.
Thank you, everyone, because my colleagues have spoken most of what I would have loved to talk on about. But my contribution would be on a global perspective. We are not talking about Kenya. We're not talking about the region. We're talking about having individuals who can be able to go out into the world and make a change. And so that change also would need to start at home. My colleagues here have mentioned all aspects of understanding what is on the ground, going through the curriculum. But there's also the aspect of how do we build this as a mindset for the pharmacists in school. So while we are thinking about the curriculum and the reviews that we need to change it, then how do we progressively ensure that this is not missed out? Because you might want to probably bring it in at the final year of school, but maybe you need to start at the first year of school. You never know. So whatever way it looks like. Pre-service, in-service, as Dr. Mungoma has said, there's also the aspect of CPD, continuous professional development. While we are doing that as PSK members, and now that we are having also extracurricular coming in, the question would be, is this curricula standardized, acceptable, replicable, globally? There's so many other little aspects that we would need to look into. Thank you.
Okay. Thank you. You've shared a couple of insights. I think John and Dr. Mugoma have insisted on a needs assessment. Now, Dr. Gloria, from our existing state in terms of the healthcare workforce, what are the needs and the gaps that you can observe that could be addressed by professionalizing the health supply chain?
Okay, thank you, Brian. I would just be looking at the entire supply chain, just the process itself, and how you get to have an efficient or an agile supply chain. So, speaking into issues to do with needs. I'm looking at in the context of a hospital. Let me start from there. Okay. How many hospitals, I know most of the level 4, 5, 6 actually have a formulary because they have the joint drug committees that they can be able to come up with a formulary and all that. But when you look at the regulations now, it's saying pharmacies must be present in a level 3. How many level 3s in these countries actually have a formulary? Okay? And are the pharmacists who are going to go there, are they enough, or are they equipped enough and understand how to develop a formulary for how to manage, in terms of developing that drug list for managing those ailments? Okay? So there is actually a gap there. Do they understand how you come up with a formulary? Okay? And which documentation will you need? Obviously, like you'll need the WHO drug essential list, you'll need the Kenya essential medicines list. Do they understand how we come up to that point and how is that cascaded downwards? Okay? Another aspect, I'm looking at any pharmacist practicing in drug supply chain organization. Do they understand how you end up with a supplier, for example? What is the process of onboarding a supplier? Issues to do with supplier selection, and how quality assurance play a key role in ensuring you get quality supplier, not only in terms of the product that they give you, also in terms of the supplier themselves. You don't want to work with a briefcase company. And how does procurement come in ensuring they do the pre-checks before you start diving into the nitty-gritties of getting a supplier on board? Another aspect, yes, you might be having your suppliers, but you are looking for quality and economies of scale, okay? How do you effectively manage your suppliers to ensure they are performing very well as much as possible? What are some of the parameters that a pharmacist needs to be looking at? Why would I go to Meds as opposed to any other supplier? What are these things that Meds is doing exceptionally? So how do you ensure that that is done in a very comprehensive manner. Looking at also in terms of issues of product sourcing, okay? It's very few pharmacists are enabled to understand that you're still governed by the Public Procurement and Disposal Act. What are the tenets of what are some of the things that are involved in that? What is the act talking about? Because you have procurement rules and laws that you must follow in order to ensure that best practices are aligned to at any given point in time. Are pharmacists equipped in that? And yes, we have a real gap there. That's something that we really need to work on very as much as possible. Do you have that legal framework that is embedded within your institution in order to facilitate that? And how do you capacity build your pharmacist in order to get to that level of point? And I believe by professionalizing, you actually capacity building that aspect as much as possible. Another challenge I know for those ones who are in supply chain is aspects to do with forecasting and quantification. I mean, you can give yourself, I need to be at 80% in terms of forecast accuracy. How well are we adopting technology to ensure that our forecast and quantification are as accurate or near accurate as much as possible? New technologies are coming up as much as possible. So the issues of culture change. How are we embracing technology as much as possible? I know there's a lot of artificial intelligence coming in. You're able to see real-time demand, and how are you responding to that? Okay? And then it comes to issue to do with logistics. Still, technology is playing a key role. Do you have EPOD in system? How well can you inculcate that into your system? So, embracing technology as much as possible. By developing these capabilities and professionalizing this health supply chain, actually you capacity build not only as an institution, but also as a country in terms of how do you respond to emergencies, especially when it comes to emergency supply chain. So those are some of the things that I was able to pick as gaps. There are knowledge gaps in terms of skills when you come to those aspects of supply chain. Once you strengthen that, I believe in a better position. Thank you.
We can get that at the end of the day, we need to benefit, I think, the client, who is our patient, our customers who's visiting our various facility. Central to this, you've pointed out a number of challenges. There's also you've mentioned maybe the inability of pharmacies to take into consideration public acts that aren't classified under them, like the Public Procurement Engagement Act. You've mentioned there is the need to have policies in place where we are speaking about level 3 and above having a pharmacist in place. Now, to look at this from the aspect of the regulations and legal considerations, PPB occupies a very central place. So I'd like to ask Dr. Mwavali, are there any legal or regulatory considerations that might affect the feasibility of professionalizing health supply chain in Kenya currently? How can these considerations influence our approach? Yeah.
Yeah, thank you. I believe first, I think we need to restructure the training of both pharmacists at degree level and also the diploma holders, as they play a very key role in the supply chain, especially at the lower level facilities. So I believe, one, we need to reorient the training so that the graduates are practice ready as they come out of school, and they're able to take up these roles immediately. So that was addressed in our recent curriculum review that proposed a skills-based orientation towards training rather than the knowledge-based training that we currently have. So that, if it's implemented, would be very key in helping or professionalizing the supply chain. The other issue is having regulations around the practice setting, and that is recognized in our draft GPP document. I believe most of us have had a look at it. We want to try define what are the roles of pharmacists and pharmaceutical technologies around the area of supply chain in terms of selection of what is required, in terms of formulary development, in terms of forecasting and quantification. And then there is the area where there is always a conflict between procurement officers in terms of procurement of medicines. I think it's an area, I don't know if it's a gap or a challenge that we need to address, so that even as we try to provide safe medicines for our people, we are also going as per the public procurement laws, and that the Public Procurement Act should not be an impediment to sourcing the medicines that the people require. The other key issue is disposal. I think most of us might have heard about disposal, but either we don't know how it should be done, or we don't have access to facilities for safe disposal of especially pharmaceutical waste. So I think it's another area that needs regulations around it, and as well facilitation so that it's done properly. In GPP, we propose upscaling and board certification around key components of service delivery, including pharmaceutical supply chain. And we also propose, and I don't know how or whether this is available in Kenya, to have pharmaceutical supply chain specialists at least level 5 and level 6 hospitals to assist in for supply chain issues. Now, another key area I think the Ministry of Health with PPB and other stakeholders are working on is to see how we can use blockchain technology to have a track and trace system, so that you can trace a batch of a product as it comes from into the country, for example, if it's imported, or as it comes from the manufacturer, and you can trace it all through the supply chain up to the user. Yeah, so that when you find patient X with batch Y, then you can trace it as it moved through the supply chain. So I think that is a heavy project. It will take quite some while, but I think it would also help in professionalizing our supply chain. Yeah, thank you.
Okay, thank you for that, Dr. Mwavali. Now let's talk about how we can integrate and bring this to fruition. I think this question will go to John. What are the potential opportunities for advancing or advocating health supply chain professionalization agenda? And also, in the role that Kenya Institute of Supply Chain Management occupies, and also with how it interacts with healthcare professions such as pharmacists, how does the organization support this move? Yeah.
Great, thank you so much, Brian. So just to confirm that we are indeed the regulator of the supply chain professionals in Kenya, and I am liking what Gloria and Dr. is saying about the understanding of the Procurement Act, and there should not be an impediment, correct, you're saying. But there's something that you also alluded to, Dr. The confusion, I think the conflict, as it were, between the role of the pharmacists, the doctors, the nurses. Everybody thinks their job. The procurement people also think it's their role. So how do we close that gap? And I think that's what we want to do. I keep telling my procurement people, I don't want you to become pharmacists, but we can actually, the easier cadre to develop is a supply chain, is a pharmacist to have supply chain knowledge. It's easier that way because they already have the technical competencies, so we're just adding on supply chain. And I think what I found out is that, medicine is really useless in an ineffective supply chain system. If it does not reach the intended, customer, then it will not really be effective. And that's been cited as one of the causes of this multi-drug resistance diseases, especially in TB treatment. So let me come to the question, but I must add also to the issue about legal and regulatory frameworks, which really need to be supported at a national policy level, which really should speak around curriculum development that address the specific issue, competence frameworks, somebody alluded to that. that are implemented through collaborations that we need to, through all our people that are here today. And I think it's possible to get that one done. The opportunities, just of advancing what we're talking about here today. It's been recently said that Kenya has entered the League of Middle Income Nations. That is actually both a problem and an opportunity. Opportunity because now we no longer have the donors that we used to depend on. They're going to be going. They'll be going slowly by slowly. Once you hit the level of $1,000 plus, you're now seen as not as needy as the likes of, say, Malawi or Mozambique. So the implication, therefore, is that we can actually develop our own locally made financial sourcing development so that we can actually start really creating our own ability. And I like what we've been talking about here, local manufacturing. How can we create local capacity to create medicine that actually are world class, and we can become a net exporter in the end of the day. So again, in terms of supply chain, we cannot continue relying on donors forever. And so we have to really create sustainable health supply chain financing, which is really pegged on efficiency in how we manage our supply chain systems, reducing wastages, getting medicines in the right place, at the right time, at the right place. That's what we call accessibility. That's supply chain 101. And ensuring that, of course, we expand the workforce of health supply chain. And I think there's a lot for everybody here to gain if we can all be selfless and work on providing the right education, the right curriculum, the right training, the right CPD, as somebody has said, and technical competencies to prepare a market-ready professional that will deal with this particular area. So this is the only way we can actually achieve our UHC, our UHC objectives, which is really anchored on what we are doing now, the Agenda 2063. How can the health supply chain 2016-2030 strategy contribute to Kenya's health policy and for the period ahead? So we are on the right track. If this can be actionable, the outcomes from here. Thank you very much.
Okay, thank you for that, John. Okay. Coming back to DHPT, they are our national directorate. So, Dr. Eunice, from the work you've done, both with the national and also the sub-county teams, now focusing on the practical impact, which areas of healthcare will benefit the most from having a specialized supply chain workforce? Yeah.
Okay, thank you, Brian. So there are several areas that, even for us at national level, we have seen that we really need to strengthen. So one is informed decision making. So at county level, for example, when they do forecasting and quantification, then you're able to know what your requirements are for HPT. Then you're able to link that with budgetary allocation. We know counties, many times they'll not get the resources they require to procure. So they're able to use that FNQ information to advocate for increased budgetary allocation. So you're able to guarantee that even as you talk about UHC, then patients are able to get what they require for health services. The other thing is improved this, it will also help to improve inventory management by reduced stockouts, for example, because that healthcare worker is able to know how to manage, how much to order, how to store, how to issue, how to transport. Because remember, if a cold chain product is not, the cold chain is not maintained, then it becomes something that's not viable. So we're able to also address issue of stockouts. They're able to order on time. Then the issue of improved documentation, so data capture and reporting. Again, even as our facility is ordering, there are several documents that they use to guide, to look at what they have consumed and what they need. So if your bin cards, for example, are not up to date, you're not able to know, this is my consumption, these are my stock out dates, then I'm able to modify what my requirements would have been if the item was in stock, etc. So we're able to ensure that we have accurate data for decision making. The other thing that we can achieve is to minimize HPT waste. Sometimes you find facilities over-order product, even from KEMSA. So you find a product is overstocked in one area of the country. So it is overstocked in one area but absent in another that where it may be required. So if a healthcare worker, for example, has the capacity to be able to do accurate quantification, for example, then we minimize the issue of waste, even through expiries. The other benefit would be, even as you look at emergencies, like during pandemics, you're able to quickly put together what you need for an emergency. Maybe it's a road traffic accident, you know that these are the products I need to address this emergency. Then the person is able to quickly, again, gather the required data and make accurate decisions on what they need. So those are some of the areas we can benefit, even as we capacity build that pharmacist to have all those skills. Thank you.
Okay, thank you. I know the audience has a lot of questions for the panelists, but also there is a parking lot there, mentee session. You can just sign in and leave your questions so that as the questions come, you can submit your questions and you can submit multiple times. Okay, we'll move to Dr. Naomi. You spoke about bringing a global context in terms of our solutions. We've heard from both Dr. Gloria and John and also the panel all across, that there are various challenges and barriers towards health supply chain specialization. Are there specific strategies or examples from other sectors that we can learn from?
That's a wonderful question.
Yeah.
I will speak as a pharmacist in logistics because supply chain is wide, very wide. So my passion is in the logistics part of it. And some of the things that I have noticed in terms of efficiency and effectiveness, because there's what the supply chain is supposed to do, and then there's the wastes that come out of supply chains. And these wastes are the ones that stop us from being, effective. And we need to delve deeper and find out what they do. Fortunately, with the organization that I work for, we are able to investigate into some of those wastes, research on them, bring them to the fore, and even begin talking on issues of resilience, because we want our health supply chains to be able to bounce back once a disruption occurs and continue in the manner that it should. So one of the concepts that we look into is outsourcing. And where you are not the sole supplier of commodities, you can rely on other sources for your commodities. You can rely on other sources for your transportation. You can rely on other sources for your distribution. I mean, the field is vast. With other industries, with other organizations that can be able to do this on your behalf. Maybe it's something that we can consider. Another one is circular economy. Yes, here we are talking about waste. How do we then ensure that we are not a contributor of waste within the ecosystem? That's a question that we need to probably raise and discuss within our circles when we're talking about supply chain practice. We're also talking about decarbonizing logistics. So a truck has just arrived this afternoon, delivering commodities for the exhibitors, and another truck was actually here yesterday to deliver things also for the exhibitors. What if all the exhibitors were asked that they could put all their stuff together, consolidate, yeah? So that you have maybe 2 trucks arriving on one day. And that in itself reduces the amount of greenhouse gases into the supply chain. Like, it doesn't look possible, but years of study on this have shown that it is actually possible. It just needs maybe an element of coordination, collaboration, proper communication, and then systems to enable this to happen. We also look into a lot of emergency logistics and preparedness. Lately, we have had floods. We have not been able to, secure commodities along the areas where these issues are happening, And so what does that mean for us? It would mean like having lots of trucks on the road, lots of people being deployed, commodities being moved around, and all of this was probably not thought through very well. And so the question is, where is the data that would inform you when you're thinking about preparedness, when you're thinking about your logistics, when you're thinking about the capacities that you have in the country that can contribute to, a rational distribution of the commodities so that even facilities are ready, not necessarily ready for a small event, but for even a big event, can even be a choice point, if something happens across the borders, if you get what I mean. So we are talking about lots of global concepts being brought into the health supply chain and seeing how we can be able to apply them for our own case. Another one is on agility and just-in-time. These are concepts that are broadly discussed when you're talking about supply chain and logistics. We would need to think through some of that. I would also wish to talk about public-private partnerships. Public-private partnerships. This is something that I came across years ago, and we are still trying to navigate the PPP space. But PPP could maybe be the savior of our health supply chains, who knows, if we consider this. Because private health facilities do their own supply chains, and public health facilities do their own supply chains. And then you have also outpatient clinics, for example, doing their own supply chains. Why can't we think of just being together and all of this, these numbers contributing to what we call the national quantification, for example, for a country, and then we keep it moving from there. When we're talking about just-in-time, you don't have to have the warehouse, because a warehouse is expensive. Holding a warehouse is expensive. I know Dr. Kigen can talk about that upon, conversations upon conversations. So maybe we could stop a little bit and think through what is it that we really want. And finally, please, let's think about also including academia. There are lots of institutions offering farmer learning, supply chain learning. Why aren't we all talking together? Thank you.
Okay. Then we have Dr. Mgoma. We know the house where people gain specialization is the university and tertiary institution. Do you see any opportunities to improve, strengthen both, or either pre-service or in-service programs to address the need of an effective supply chain workforce? Yeah.
Yeah, maybe just before I focus on that, I think it's also important just to appreciate the different sectors and the different levels of practice that pharmacies engage, even as we speak about supply chain. Because this cuts across people in community practice that might have just one pharmacy, right to people who are doing big wholesale and distributorship. Meaning, with the different levels, then we expect different levels in terms of just application of the skills and knowledge around supply chain. So with that, I was thinking about the CPA model. We know that certified public accountants would normally go through different levels, CPA 1, CPA 2, and so on and so forth. With supply chain management, I think we could borrow this model and say that if you're operating at this level, then you're expected beyond maybe your basic pharmacy degree to be able to upskill yourself so that you're working very, very efficiently, even at that level if you have just one community pharmacy, to ensure that your product because we're not just looking at how this product is being pushed. But I'm happy that we've also talked about quality. We've talked about, is this product arriving at your pharmacy on time? Is it arriving in the form that it is? Is it coming on a motorbike? Is it coming in a van, and so on and so forth? Right to those that are importing, to ensure that there is timely delivery, there is timely, and that the product actually arrives in the conditions that are expected. So when it comes to the university and the opportunities, we now have an opportunity with the core curriculum being reviewed to allow institutions, universities, to apply what the industry really needs out there. And like I said, have that opportunity of engaging teacher practitioners, so that we have people who are out there, expert in supply chain management, being employed at the university deliberately, so that even if they're not full-time employees, they actually come in as visiting lecturers, whether it is timetabled, or they can even come in at the end of a program. I've seen certain institutions that are able to come up with a 2-week program post the last exam paper, that have students go through a 2-week intensive course on a specific area, and in this context, supply chain management, so that, one, you can raise the appetite of some of the graduates who are really interested in supply chain. Because in our context, sometimes people get employed and you end up doing something just because the employer demands that. So if we can bridge that gap, create this real appetite, then we are able to have sustainable specialists in supply chain. Thank you.